My son started having some issues a year ago this past March, and a friend of ours in DC had their psychiatrist refer us to Dr. Axelson here at the Behavioral Health Pavilion after we had already made a couple visits to the PCD. I did not realize you had a whole pavilion. So we had just come to the ER since it's children's, and living in a small town, we don't have many of those options around us. So when we went to the ER, we saw that to come over to the Behavioral Health Pavilion, and that they have the entire PCD psychiatric crisis department here just for that. So until that moment, our first visit here in September or October of 2022, we had no idea it was around. There's nothing like this around us. We live 2 hours away. It's just comforting to be able to come to a place where there's everything that you need here. You don't have to source out everything from multiple different locations. Like if you needed to, you could do everything in-house in here and have one complete cohesive team and really ensure continuity. I found out about the room here either through the PCD or my parenting support specialist. In moments when you just feel like you're about to just keel over the mountaintop, it's been a place where you can come and recollect and regroup and regather. Grab a bite to eat if you've missed the cafeteria, as often has done. The hours work out great, so you can grab a bite or just a drink. Sometimes a cup of tea is an immense comfort, and a smiling face at the door, offering just some warmth and kindness and sympathy is invaluable. Actually, Rick Shepard was working in the family room in the Behavioral Health Pavilion the first time I came up here, and he told me about the Ronald McDonald house, and my parenting support specialist also helped me and to get a referral so that I was able to stay at the Ronald McDonald house, which made my son feel so much more comfortable being here by himself versus me having to stay with him the whole time. So it allowed me to get the rest that I need to then be able to go home and take care of him and give him some independence on dealing with his own things as well. It was a very welcoming environment. Every staff member, volunteer that I've run across has been nothing but warm and lovely. It just makes an awful situation feel a lot less scary. And like you're just not alone out there in the world. You hate to hear that other families are going through this. It's not fun, but it's also nice to know that you're not alone and that you can help other parents or other parents can help you. And if you've had help from outside, that you're able to pay it forward and just make sure that people aren't left just hanging and dangling through these situations, because it's overwhelming. We never know when we're going to show up, so it's not something I can plan. And I've been fortunate that each time there's been a spot over there, a room open. And so it's given me the ability to get respite and much needed sleep and rest that I need to then further care for my son. And I've met other families that are going through other health crises or similar health crises, whether it's physical or mental. And it's just, again, a very welcoming, warm environment. They're there to make sure that everybody is happy and healthy and as much as they are able to. And it just kind of helps provide the ability to do so without also the financial stress of an already stressful financial situation with your child being in the hospital and everything else too. So it's just great to see everybody interacting over there too. He has said that knowing that I'm just 2 blocks down the street makes them feel much more comfortable than knowing I'm either 2 hours away back at home or even 5, 10, 20 minutes away. I can walk here in 5 or 10 minutes, which on a nice day is great for the mental state. And it's a quick hop over here for a drive, or catching a shuttle or a ride over there to and from is always an option, which is great. So it's just nice to have that support, because sometimes you just don't feel like driving or you get caught in the rain. Even just getting laundry done while you're there so that you know they're coming home in clean clothes because you didn't get them here, or maybe you came up in that pair of clothes as I've had to do a time or two, and all I had was an extra t-shirt from the hospital. So those are, and I've done laundry up here in the family room and at the Ronald McDonald house. So it's it makes being away from home less intimidating, less inconvenient, and just much easier to then focus on what we need to do with our kids. And like you said, the mental health of the parents is just as important as the kids, so that they are able to then battle what they need to, or be ready to tackle whatever they have to do when they get home. If you're there, you can grab, there's always stuff in the fridge too, or you can bring your own stuff in. So you're never without, you never have to worry about something you may have forgotten or left behind as you ran out the door. So it just makes such a stressful situation less stressful, knowing that 95% of the time they're going to have what you need. It is slowly helping. Anytime you make a change, unfortunately, on these things, it's kind of like you're starting over again. So it's been a little slow, and you just want to see your kids get better. But there are cheerleaders here and people helping find the rays of sunshine and, lights at the end of the tunnel in times that you just think there's no hope whatsoever. So we're going to get to the bottom of all of this, and we still have a long road to go, I'm sure. But knowing that there's a place to go and people around makes it a lot less intimidating as a whole to come to and really tackle or even consider doing, because it really is intimidating and overwhelming if you have never had any experience with any of this before. Lots of different acronyms and new terms and whatnot. So it's dire to have these resources, really is.